Myanmar is currently undergoing rapid socio-economic development that has the potential to vastly transform the daily lives of its population. However, the pace of this development has created an environment conducive to the rapid growth of non-communicable diseases or NCDs. NCDs are chronic, long-term diseases that require ongoing management and treatment. The main types of NCDs are cardiovascular diseases, diabetes, chronic respiratory diseases, and cancer.
Myanmar is currently experiencing epidemiological transition wherein the burden of non-communicable diseases is increasing very sharply. As per the World Health Organization, 59% of deaths in Myanmar are occurring due to non-communicable diseases. And these sharp increase in NCDs is because of changed lifestyles. Main risk factors of NCDs are unhealthy diets, harmful use of alcohol, use of tobacco, and insufficient physical activity. And as per the 2014 round of steps survey, 94% adults in Myanmar are living with at least one of these risk factors, which is very huge risk factor burden of NCDs in Myanmar, and that is contributing towards increasing the mortality and morbidity burden of NCDs.
In Myanmar, 26% of people smoke tobacco, 43.1% chew betel nut, 22.4% are overweight, 26.4% have raised blood pressure, and 36.7% have raised blood cholesterol.
This project is a 5-year project, and the major objective of this project is building capacities of University of Public Health and wider health stakeholders for building their capacities in policy development, policy analysis, and strengthening health services for preparing them towards addressing this NCD burden in Myanmar. The major strategic components of this project are 4, which are research, policy, capacity building, and communications. So we have a series of activities in each of these strategic components.
The project is being implemented by 4 partners: HelpAge International Myanmar, University of Public Health, University of Medicine 2, and the Faculty of Public Health, Thammasat University, Thailand. The project works closely with the NCD unit of the Department of Public Health, Ministry of Health and Sports, Government of Myanmar.
I'm Professor Kimamya, University of Public Health Acting Director. I have been working this university since year 2011 as the responsible for the epidemiology department. We are collaborated with your project, and now I think since about the year 2015, we have to conduct the assessment of the research gap for the NCD is the first activity, and second one is mental health literacy in the community. And now the third one is we have the faculty exchange for the Thammasat University, which is one of our collaborated university. And now year 2017, April 25th to 27, we have conducted the health policy development, which is supported from the faculty of the Sydney University of Public Health.
My name is Professor Koko, Professor Head of the Department of Diabetes and Endocrinology, University of Medicine 2. For our university, we are leading the integration of the NCD service into the primary health care. What we call is the PEN service. So the PEN service with the HelpAge International will train the township medical officer. There are 330 townships in the whole country. Will do within the 3 years' times on all the training program for the township medical officer. And then township medical officer will later on the multiplier course for the basic health staff. By doing this, we can do the NCD service, that's a prevention and control, mainly diabetes, hypertension, and some cancer in the early screening and diagnosis, treatment, and referral in the rural area. Because in our country, 70% live in the rural area. So that is very much important to get the access to the NCD service. This is the first time in Myanmar, never been in the Myanmar in the past for the NCD service in the rural country. So thank you very much for the EU and the HelpAge International for start ball rolling of the NCD service in the primary health care.
Rural health centres form a major part of the health system in Myanmar. The project intends to strengthen them as part of the integration of NCD services into primary healthcare. The capacity building component of the project is strengthening rural health centres in offering prevention and control services for NCDs through pen intervention.
I'm Dr. Kim Asu, Township Medical Officer of Langkaya. From the government, we have received devices and essential drugs for major NCD and HelpAge International project support, TOD training for township level, and manual books for pen intervention.
How does this feed into HelpAge International's global strategy?
Health is a very important area of work that we do, but not as much in the region. Myanmar is the only country where we have a project that focuses on the non-communicable disease. It's a great opportunity in this country to engage with the government, the Ministry of Health and Sports, to raise awareness about this issue, because in Myanmar there's a lot of focus on communicable diseases, but not as much on NCDs, and that's what this project is helping us to do. The European Union has been a long-term donor and supporter of HelpAge International work globally. In this particular case, we are very fortunate to have as part of a global project that the EU is funding in 8 countries, and HelpAge is the lead agency in Myanmar. And EU support for this particular project is all the more welcome, because it is opening up a new area of work on health in this country.
The project has made significant progress. However, Myanmar continues to face many challenges in combating the burden of NCDs over the coming years.
We are doing like a pen scale-up, the pen package or essential NCD, mainly for hypertension and diabetes mellitus for the rural population by our BHS. So this is scale-up plan. We are working currently with the HelpAge International with support of whatever technical or financial and the ratio of course. So this is one area. Another area is that we are doing like exchange learning program. The HelpAge International signed with TPH, TOPH, UM2 and UOPH and all I think the Master University in Thailand. So we are doing some exchange learning program. That will also improve our capacity in terms of policy development, other the intervention. Another area is currently we just finished the formulation of national strategy plan on NCD, this 5-year plan, with technical and other the financial support from the NCD. So we are going to disseminate very soon, I think. Once the ministry approve this the document. That's why we use as a guiding document for the country. This is very important. One of the activity working and close collaboration with the HelpAge International. And of course, in the future, we are going to form like NCD Alliance again with the support of HelpAge International. This is also, as I mentioned, your multi-sectoral strategy. Involving all the stakeholders is very important. That's why we are going to form like a very systematic way, like an NCD Alliance. These are some the important activities currently we are doing in collaboration with HelpAge International and NCD unit, of course, in the UM2 and the UOPH in the country. Thank you.
By working closely with the government, partners, and key stakeholders, the project is committed to strengthening public health capacity to address the burden of NCDs in Myanmar.